Let me start by apologizing, colleagues, for all these technical glitches. These things happen to the best of us. In so doing, I would also like to thank Rico, who started us on a journey last week in understanding mercury, as well as how we can sustainably manage mercury and its impact in healthcare settings. Now, before I start, I just want to go and do a call of action to all the healthcare professionals that are in this room, especially the dental professionals. As you are aware, we hold a dual responsibility to our patient and the planet. The time has come to align healing mission with sustainable practices that preserve the health of both people and the environment. Mercury containing devices, including amalgam fillings, continue to pose significant threats to public health and ecosystems through their release into the air, water, and soil. Despite global commitments like Minamata Convention on Mercury, mercury persists in many dental settings. We must lead the change to eliminate mercury-containing devices, transitioning to safer, effective, and alternatives that uphold both patient safety and environmental stewardship. Furthermore, the rising volume of oral healthcare waste requires urgent attention. Inadequate segregation, handling, and disposal contribute to pollution, occupational hazards, and strain on municipal waste systems and management. This is particularly critical in low resource settings where waste infrastructure is limited. In so doing, there are about 5 advocacy actions for dental practitioners that we must uphold. Number 1, phasing out mercury-based materials and support national and global. Now go to the previous slide. I'm just doing the call of action. It's something that I wrote. I have not started with the presentation. Phasing out mercury, yes. Phasing out mercury-based materials and support national and global initiatives towards mercury-free dentistry. Number 2, implement green procurement policies, choosing eco-friendly material and reusable instruments wherever possible. Number 3, practice comprehensive waste segregation, meaning separation or segregation at point of generation or at source. Number 4, educate staff, patients on sustainable dental practices and the importance of reducing environmental and digital footprint. I believe this is one of the platforms whereby we are sharing knowledge about this. Now, lastly, collaborate with policymakers and professional bodies to embed sustainability in dental curricula, facility design, as well as national oral health strategies. The future of dentistry is not only pain-free, but it is also pollution-free. Let us embrace innovation, responsibility, and resilience in our practices. The health of our communities and our planet depends on the decision we make today. Act now, practice sustainably, and lead the change. That's the call of action that I just wrote and that I just wanted to re-emphasize, building up on what Rico has already started last week. Next slide, please. Next slide, Kilopile. So there is a growing concern about the importance of sustainability in oral healthcare settings. And I will just look into this conversation. I'll just touch on 3 things: mercury waste management, and we'll look into comprehensive management of healthcare risk waste handling in healthcare settings, and as well as touch on some of the guidelines and the research areas that we can maybe utilize to advance sustainability in our settings. Next slide. All right, yes. Now, looking at mercury waste in dental settings, the primary source of mercury exposure in dental setting is the use of amalgam, which is approximately 50% of which composition is about 50%. And mercury vapor can be released during the mixing and condensation of amalgam. Also, the removal process, especially when using older techniques or ultrasound condensers, can generate significant amount of mercury vapor. Exhaust air from the dental vacuum system can contain mercury vapor as well, especially during removal, as well as burying or cremation of bodies of people that had dental fillings that contain mercury. Dental personnel are also at a higher risk of exposure due to their direct involvement in amalgam fillings. So there is an occupational element when it comes to dealing with mercury. Next slide, please. Now, I'm not so sure how many of you know about the standard. The ISO 11143 of 2008 specifies the requirements and test method for amalgam separators used in connection with the dental equipment in the dental treatment setting. Now, I'm not so sure if you guys are aware of the South African Dental Association, as well as the Dental Recycling International, which was founded to further the new international opportunities outlined in the Minamata Convention, which calls for the eventual phase out of reduction of mercury that is used in dental amalgam. The DRI delivers a complete solution to new DFF regulation, that was put in place in February this year. And there are some benefits for members. Number one, they can allow you, or they can give you access to a free amalgam separator unit to the value of 32,538, provided that members sign that contract. There is a contract that you need to sign that allows them to collect the mercury for servicing. I think Rico also touched on this last week. Another one is the treatment, the training that they offer to you as well. They offer sustainable development training as well as best practices in terms of dental health and dental practices. Furthermore, if you want information regarding this, there is a conference, colleagues, next week on the 25th until the 27th of July that is hosted in KZN at the Durban ICC. Now, you will get more information about this. I'm not a dentist, but there is a conference where this information will be shared among members. I'm sure you guys know about that. Next slide, please. What are the key considerations for sustainable management of oral health waste in oral health settings? Number one, we need to do waste audit. Now, in terms of waste auditing, the waste auditings, we do them on different frequencies. In a hospital setting, we've got the monthly graded assessment, which assesses the waste disposal practices of the healthcare practitioners. And it gives you a score in terms of compliance. Are you segregating your waste accordingly in accordance with the standard? That's one of the audit that we do. The frequencies on a monthly basis. We also have the one that we do on a quarterly basis. This one involves the licensing part because all the health establishments must be licensed as generators of healthcare risk waste. Now, on a quarterly basis, the external body, either the municipality or the provincial authority, can come and do quarterly assessment that will serve as an external audit for the facility concerned or involved. We also look into material selection. Here we advocate mostly for reusable items, reusable medical items to advance sustainability in oral health settings. As well as proper labeling and storage, we advocate for access control. We advocate for labeling of different healthcare risk waste items that are found within a healthcare setting or a dental setting. Training and capacity building, I believe that's what we are doing as we speak. Policy and regulation, there is progress. However, South Africa is still not yet there in terms of international standards. What is so good is that we are able to apply this international standard. We are able to have access and apply them in our settings as well. Next slide, please. What are the specific considerations? Now, some of the specific considerations, we need to have a designated healthcare risk storage with access control. I mean, it must be locked up. We don't want anybody to have access to health care risk waste, especially health care risk waste. To deal with minor spillages. So when we do the waste audit, we will look for the spill kit as well when we get into your practice or your healthcare facility. Record keeping, the waste file, the manifest documentation, as well as the certificate, the disposal certificate. We need to see if your waste is being collected by a service provider and if it is being treated at an approved landfill site or at an approved treatment facility. And they must give you a treatment certificate to ensure that your waste has been safely disposed of. So these are some of the things that we look at when we do the auditing. Next slide, please.
Sorry, Tshepo. Sorry, Tshepo.
Yes.
I think we lost you at the beginning of your last slide. If you do not mind, could you please go back and just give us the first two bullets again? We missed you. Your network was not stable. Thank you.
Okay, am I audible now?
You are fine, thank you.
Okay, so you can go back to the slides where you want me to start. Do you want me to start with the call of action?
No, just this one, this slide, yeah, at the beginning. Thank you.
Okay, so there are specific considerations for dental practices. Number one, you need to have a designated healthcare waste storage. That's a standard. Colleagues, when we enter your dental practice, when we enter your clinic, if you work in a clinic or if you work at the office somewhere, we need to see where you store your healthcare waste. And that storage area must be able to have compartment for healthcare risk waste as well as healthcare general waste. We don't mix them. The same goes to amalgam waste. When you generate amalgam waste, there are two preferred or recommended disposal method: encapsulation as well as recycling. That's what we would recommend as well as practitioners. Number three, you need a spillage kit to be available. Now, a spillage kit is to allow you to be able to deal or to address or mitigate minor spillages of healthcare risk waste concern. For an example, if a sharps container falls off in your facility while performing a procedure, that equates to a spillage of healthcare risk waste, and it must be treated as a potential risk. Therefore, a spillage kit must be applied, and appropriate procedures also must be followed when dealing with the spillage. The most important thing is record keeping. Colleagues must have files about waste. The file must include the manifest. The manifest is the document that the service provider leaves you, the practitioner, with when they come and do the collection. So it's like proof to say, we came and collected this much of waste. And after a month, after they have treated your waste, they must give you that manifest. It must have 3 stamps. We call it now, it's no longer a manifest, it's now a certificate of disposal, because it will have 3 stamps. The stamp from the treatment facility, the driver, as well as the facility, to show that waste was collected from either Bongani or from Universitas to a treatment facility in Gauteng. And here are the authorization stamps to show that that waste was treated accordingly. Next slide, please. What is the role of environmental health practitioners? Now, this is us. Fortunately, in South Africa, we have started employing environmental health practitioners in our hospitals. Therefore, our public dental practitioners are well vested with this information that I'm sharing now, especially those that are working in hospitals. If you are working in private, or if you have your own private practice, then just be aware that sometime, at some point in your practice, you will receive a visit from my colleagues that are working in MHS, Municipal Health Services. We call them the local inspectors. They will come and do a healthcare risk waste monitoring at your practice and enforce the rules and regulations according to the norms and standards of environmental health in South Africa. They will also offer you some tips on how to reduce your waste, especially minimization of healthcare risk waste, offer trainings as well as education. We can also assist you in designing those posters that allows you to inform your public, your patients that visit your private practice, to say this is the appropriate ways of handling waste that is generated in dental settings. We also offer advice on circular economy. This is a new initiative whereby we are trying to promote circular economy in healthcare settings. And the dental settings, or the dental practitioners, are also one of the sectors that fits nicely into this concept of circular economy in healthcare settings. Collaboration and partnership. With us, we collaborate nicely with the Global Clean and Healthy Hospitals Network, which is a network that allows us to share best practices as well as learn from, from others that are already doing these sustainable practices in terms of advancing healthcare waste. Next slide, please. Now, these are the oral health champions in our facility. Depicted there is our dental assistant as well as our in-house dentist. Now, what I want colleagues to take note is the PPE that they wore. We are trying by all means to wear reusable items. We are trying by all means to advocate for sustainable initiatives, those small gains, those small initiatives. We do have a laundry system, so we are able to wash our PPE, our reusable PPE in healthcare settings. Next slide, please. So sustainability is something that we are able to advocate for. We do have alternatives. In our facility, we do have mercury as well as alternatives for mercury. What I love about what the doctor said when we had a meeting on Monday, she said that she likes alternatives. However, there are some instances where they are compelled to use your mercury-containing devices. In when she explained it, she said to me they prefer to use it at the back of your teeth. Actually, our facility, we are championing these alternatives when it comes to sustainable practices in oral health. Next slide, please. Now, this is the health certificate from the municipal health settings. The certificate is issued once every year. For you to receive it, they need to come and do a thorough assessment, and then they will write recommendations if they found some discrepancies and non-compliances. And then once you have addressed all those, they will issue you with your certificate. Now, the certificate also form part of the requirement for the OHSC, meaning if the OHSC comes to your facility or your dental practice as well to conduct an assessment, they will ask you where is the health certificate provided by the MHS colleagues. So this is one of the requirements for health establishment, whether in private or in public. Next slide, please. This one is very important. Dr. Hebab, when we were having the meeting on Monday, she explained to me that it is her duty to explain to the patient, especially when doing the fillings, because she explained that she prefers the alternative, the plastic filling. So she will explain to the patient what are the benefits of using amalgam based or using, the mercury based or the plastic based filling. So informed consent, it depends on us as the professional to inform the public and also to allow the public to make an informed decision about their dental needs. Next slide, please. This is a typical waste audit report. I'm not so sure if you are able to see it, but it has the score. So normally you will have a score, and the score will outline your practices in terms of segregation, because segregation is one of the most important things. And if you are not doing it right, you will not get 100%. You can ask them here in my facility. So it's easy to pass the assessment, but it's not so easy to get that 100% because now we are dealing with the practices. Now, when we are dealing with the practices, we need to understand that it's a routine. Therefore, our practitioners need to learn to make waste segregation a routine when dealing with or when conducting dental procedures in their dental practices. Next slide, please. Here is just to give you a brief of what you are having in your healthcare practice or office or your dental office. Infectious waste is your gloves and your gauzes or your bandages. These, the law says they must go into a red plastic. In a hospital setting, we utilize pedal-operated bins because we want to minimize contact. We want to minimize touching. Therefore, for infection control purposes, it's advisable to use pedal-operated bins so that we minimize cross-contamination. The sharps are usually in yellow, and we use them for containerizing anything that has potential to puncture or to cause any laceration to the human body. The chemical waste we don't necessarily generate in our setting. However, when you generate it, it is important also to apply precaution when disposing of the expired chemicals or the empty containers. Pharmaceutical waste, this one is very important, especially for practitioners that do not have what you call service providers. We usually flush our expired medication. Now, the challenge with that is that you can flush it, it will go down the drain. However, it causes the damage at the sewage treatment plant, because the sewage treatment plant, the bacteria that they use at the sewage treatment plant is not accustomed to dealing with pharmaceutical products. Therefore, we are actually killing the nice bacteria that does the massive work of breaking down all the feces that is coming from the sewer network. So it's very important to exercise precaution and stop flushing expired consumables. I usually say when we are conduct training, when dealing with expired consumables, it's back to sender. You know, if you receive it from the clinic, if it's expired or you demise, take it back to the clinic where you received it from, and then they should know better how to dispose it. For general waste, we always advocate for recycling or repurposing of the waste. Next slide, please. Oh, this is just a typical setting at Bongane Regional Hospital that outlines how we set up our healthcare risk waste procedures. So we do have general waste bin as well as the medical waste bin, and those are the sharps containers that you can see. And what's important is the labels. Those labels, those biohazardous international signs, this is the information that we use to inform the public about the dangers of what is containerized inside these receptacles. Next slide, please. Now, in terms of oral healthcare waste management, segregation is very important. I've just shown you the color-coded bins. It is important to put them next to each other, red and black. Because if you don't put them next to each other, then you run at a risk of polluting your receptacle. If you cannot throw something in the black bin and take it out, put it into the red bin. That's cross contamination. So the advice is that we enforce segregation at source. Hence, we make it easier for you to be able to do that by placing two receptacles with appropriate signage and appropriate color coding. Black for general, red for danger or for infectious. And the preferred method of treating incineration is not advisable, colleagues. However, in South Africa, we still incinerate our pathological waste. That's why I put it there. But we recommend non-burn technologies for dealing with medical waste treatment. We also advocate for sustainable practices like reducing disposable. So if you are still using disposable PPE in your practice, please think otherwise, especially when it comes to that. And also the X-ray films, if you are still using the X-ray films, it's high time that you transition towards digital films like your memory stick or your disc or DVD. Yes, those are the alternatives that you can apply and move away from your X-ray films as well. Next slide. Now here we are struggling, colleagues. We do have a standard, a guide, but it's general. It is not specific. There is a need for us to develop a specific guidelines that deals with oral healthcare waste. And that guideline, as we develop it, it must align with the World Health Organization standards. It must align with the ISO. It must also align with the Minamata. There is progress in terms of that, but we are far away from, in comparison with our counterparts. You know, you're talking about the US, you're talking about those in the developed countries. And there's also a need to integrate the environmental health information system. This is the system that we are using to conduct your live inspections. For example, the system is in its pilot phase in my district. Therefore, there is that live data that is being generated when it comes to this. Now, it's very important that we integrate this also for dental health providers as well, not only medical officers. We must also think of dental practitioners as well, because they do have offices. So we must also find a way to incorporate them into the system. And also, we must also look into their infrastructure standards. When we do the inspection, when I come into your facility, I would expect you to have appropriate receptacles when dealing with different types of waste that are being generated in your facility or in your private office where you are seeing patients. We usually do our monitoring. Either it's unannounced or it's a scheduled invitation whereby we come either on a monthly or on a weekly or quarterly basis. We also offer trainings, not only to practitioners, but also to the public, to inform the public. So an EHP can go to the public and emphasize the need for them to say no to dental amalgam filling, and ask the dental provider to say, I want an alternative of amalgam in my filling. And then they should be able to get assisted. Next slide, please. Now, these are some of the things that we can look at. Like I said, in our facility, these are some of the initiatives that we've already started. Instead of us using the wooden or plastic tongue depressors that you can dispose every single use, we do have a briefcase that is full of stainless steel autoclavable tongue depressors. And on a weekly basis, we are able to autoclave them. Now, what's so nice about this is the waste treatment cost or expenditure that is being saved once you start with this kind of an initiative. It might be costly in the beginning, however, in the long run, you are able to save money. That's what I like, or that's what we would recommend. That's why we would recommend reusable items for your dental practice. There is that cost benefit in the long run. Next slide, please. Yeah, this is just a typical example to show you what I'm talking about. Next slide, please. For me to come up with these initiatives, some of them through the Global Clean and Healthy Hospitals Network. Remember, this is the network that allows us to engage and learn best practices in health, either from private or from public. So I have engaged with colleagues from KZN. I have engaged with colleagues from Western Cape. I have engaged with colleagues that work in Netcare to come up with these best practices that are easily adoptable for our facility or our province or our setting. So we advocate for learning from each other. That's one thing. The other one is the use of PPE. We advocate for reusable PPE items at all times. Next slide, please. Just want to move quickly. I can see the time. Here, there isn't much about, because now during COVID, we had a lot of confusion, especially when we were dealing with disposable items versus autoclavable or reusable items. So we still advocate for reusable items, even in your food food preparation settings, we always advocate for reusable items. Therefore, once you start implementing this, it is important to observe or to adhere to strict autoclaving decontamination procedures. It's very important. Next slide, please. Now, just to close up everything that I've just said, mercury and chemical waste need controls. We are lucky to have reference documentation from the World Health Organization, as well as different forums, including this one, that allows us to have platforms like this, whereby we are able to discuss such issues. Now, for mercury, it has become one of the most important issues of public health concern in the 21st century. For example, on the 14th of July in 2020, the Environmental Protection Agency instituted the use of amalgam separators for all dental practices in the US. Now, this is one thing that is coming into South Africa in the coming years or in the coming months. So we are able to learn from our counterparts as far as best practices are concerned. We also enforce segregation at source, at point of generation. This will allow us to minimize pollution that emanates from dental practices. And there is an urgent need for us to develop these national guidelines that specifically deals with oral health waste. And I would like to believe that this forum, the Public Oral Health Forum, is one of the forums to champion this mandate. And there is a need for us to engage into research, especially when it comes to different tools, different or sustainable waste management initiatives that can be applied in dental settings, and as well as looking into how to protect especially the dental practitioners that become exposed to mercury in line of duty. Because now we have seen that mercury exposure also has a potential to become an occupational exposure. So we need to invest into these green dental practices to advance sustainability in our setting. Let me start by apologizing, colleagues,